and thank you for tuning into the channel where we provide you with tips and tools to help you move with purpose. A few years ago, I posted a video on how to strengthen your medial or inner hamstring muscles. You can find a link to that original video in the description below. Recently, I got a question posted in the comments of that video asking if by strengthening those medial hamstrings, it would help with a tibial external rotation. The short answer to that question is yes. However, there are a lot of other considerations with this kind of a presentation, and things can also impact your hip, your knee, ankle, and foot joint. So I decided to unpack this question a little bit more and explain things in detail. If you find the information from this video helpful, please subscribe to the channel, give it a like, and share it with your friends. Thank you. What's external tibial rotation? So if we have your thigh bone here, and this is your shin bone here, which is your tibia, and we're stacking them on top of one another, the tibia will rotate outward on that thigh bone. You can check if you've got tibial external rotation by finding the bottom aspect of your patella or kneecap, and then the tibial tuberosity, which is a bony prominence on your shin bone, and seeing if they align. If that tibial tuberosity on the shin bone aligns to the outside of the bottom part of that patella, then there is some external tibial rotation occurring. Pronation and supination of the foot. So I often find these terms to be misused, and it's fairly easy to find them confusing. So with the hand, pronation is this, and supination is this. So a lot of people think that that's exactly the same with the leg, where you turn it out and that's a supination, and you turn it in and that's a pronation. However, that movement is usually coming out of the hip joint, sometimes it's coming a bit out of the knee or the ankle joint itself. And that's not actually what pronation and supination of the foot is. Pronation and supination of the foot is actually happening in the foot itself at the subtalar joint, and is a combination of the three cardinal planes of movements that we have in the body. That's a combination of your sagittal plane, your frontal plane, and your transverse plane. There is a link in the description below to a video that fully explains that. For now, the presentation of pronation or overpronation of the foot is going to look like a flattened arch, where the ankle is going to look a little bit kinked in, creating a flatness of the foot. For supination of the foot, it's going to be the opposite, where the arch of the foot looks a little bit higher than normal, and the ankle sits in a slightly kinked out position, and that kind of creates a scoop of the foot. So with the appearance of an externally rotated tibia and an overpronated foot, what is usually happening is, right now, my leg is aligned properly the way that it should be. But if I have internal rotation of the femur, so this thigh bone here, so this is usually an issue with the hip, and this starts to internally rotate, it's going to create external rotation, or the appearance of external rotation of this tibia. And now, due to those loading patterns, you're going to see my ankle want to kink in, which is going to create a flattening of the arch here and the overpronation of the foot. So how can strengthening our medial hamstrings or inner hamstrings help with this alignment issue? First, let's take a look at the hamstrings and the lines of pull that they produce themselves. First, we've got the biceps femoris muscle, which is the most lateral hamstring. So that attaches to the lateral portion of your sit bone and travels down the back of the leg, and actually it crosses the outside part of the knee, attaching onto the head of the fibula bone. So that's that bony prominence here on the outside of the knee. Now this muscle is usually found to be more dominant on people and tighter. Now that line of pull can actually cause external rotation of the tibia. And if that muscle is constantly tight or it is dominant, it can hold that tibia in a position of external rotation. Now your semitendinosus and semimembranosus muscles, they attach just to the inside of where your biceps femoris attaches on that sit bone. And they actually travel down the back of the leg and the inside of the leg down and attach to the inner portion of your knee, crossing the inside part of your knee joint, and they attach to the tibia or that shin bone itself. Now the line of pull that that's going to have is going to help internally rotate that tibia. So having a balance between that biceps femoris and those medial hamstrings is going to help keep that tibia in better alignment. This was a very localized look at tibial external rotation. Stay tuned for part 2, where we're going to take a look at what's going on at the hip joint as well as the core region itself that might be contributing and even probably more of a root cause to external tibial rotation. For an exercise suggestion that might help with this condition, you can check the description below for a link to that. You can also reference the original video. I hope you found this video helpful. Thanks again for watching. Once again, please like and subscribe to the channel and share it with your friends. Thank you so much.